The skin has two layers, the epidermis, which is the stratified squamous epithelium, and the dermis, which is the connective tissue layer. There is also the hypodermis, which is another connective tissue layer below the dermis. There are many different functions of the skin. These include resistance to trauma and infection, resistance to water, UV radiation, and harmful chemicals, vitamin D synthesis, sensation, thermoregulation, nonverbal communication, and transdermal absorption. There are 5 different types of cells in the epidermis. These include the stem cells, the keratinocytes, the melanocytes, the tactile or Merkel cells, and the dendritic or Langerhans. Stem cells are located in the deepest layer of the epidermis and give rise to keratinocytes. Keratinocytes synthesize keratin. Melanocytes synthesize the pigment melanin. Tactile cells are touch receptor cells associated with dermal nerve fibers. Dendritic cells are macrophages that guard against pathogens. There are 5 different layers of the epidermis: the stratum corneum, the stratum lucidum, which is only found in thick skin, the stratum granulosum, the stratum spinosum, and the stratum basal. Acne vulgaris is a skin disease that involves the blockage or inflammation of hair follicles and their accompanying sebaceous gland. Because acne is caused by sebum or oil clogging the hair follicles and its sebaceous gland, acne involves both layers of skin because the hair follicle starts in the dermis and continues through the epidermis. The symptoms of acne vulgaris are non-inflammatory open or closed comedones and inflammatory papules, pustules, and nodules. These are more commonly known as pimples or blackheads, and commonly affect the areas of the skin with the most sebaceous follicles, such as the face, upper chest, and back. Some people with severe acne can also experience pain because of large and deep pimples that are called. Most often, there is no type of specific test to diagnose acne, except for hormonal tests to see if there are extra levels of testosterone in women. Acne occurs mainly in teenagers because the hormonal changes during puberty cause the skin to become oilier. Acne can also be caused by friction or pressure on the skin, stress, and if you have a family history of acne. There are many different ways to prevent and treat acne. These include topical and oral antibiotics, topical retinoids, oral contraceptives, salicylic acid, benzoyl peroxide, and for mild acne, simply washing your face. Though acne does not normally affect a person's everyday life, some people may experience the psychological effects, such as depression.